Hi, my name is Laurie Pittman. I am an emergency room nurse and flight nurse for the last 9 years in southeast New Mexico. I have a draw to working in rural emergencies in this part of the country. I believe that emergency services, critical care services, and trauma services are difficult for patients to access, and it's important that nurses be drawn to these areas. One important idea in nursing is disaster nursing. Recently, the United States has been hit with several disasters, hurricanes in particular, that really stretched and taxed the limits of the healthcare system and the nurses. Right now we have acts in place, federal protections for nurses called the Good Samaritan Act that protects nurses who are associated with a government entity and or a nonprofit. So if they happen to go to a disaster area, they're protected against any kind of litigation or liability issues. However, what we don't have is protections for nurses who are already on duty during the time of a declared disaster. I'd like to institute a policy called the Disaster Nurse Professional Protections Act. This act would protect the liability of nurses who are already on duty during a declared disaster. These nurses are usually working in extreme measures, without water, without electricity, high patient acuities, outrageous nurse-to-patient ratios. Sometimes there aren't even physicians around for them to be able to get orders for patients in these events. So it's important that that we recognize there are events and situations where the normal standard of care must be altered and adjusted to meet the demands of a disaster. I ask that this policy be placed so that we can protect not only the nurses who go to volunteer for disasters, but the nurses who are already on duty. They should receive the same protections that are afforded. I believe that this policy can be instituted through the Emergency Nurse Association. This is a powerful group of nurses. They're actively involved in changing laws that protect nurses, but also that protect patients. This policy would protect patients in particular because nurses would not be fearful of litigation issues, and they would stay and care for patients in declared disasters. So I would hope that you would please look at the DNPA Act and support it. I think it's something that would be a positive impact, especially in rural areas, that there may be a delay in time before nurses and providers are able to get to the disaster area and offer relief and rescue. Thank you for your time. And again, my name is Laurie, and please support the Disaster Nurse Professional Protections Act.